In this section, we will explore what and where the thyroid gland is, what is its function, and what impact does it have on the body. Once we've explored what is normal, we will see what happens when the thyroid gland doesn't function adequately, and the impact it has on the body. In the first session, we will explore the underactive thyroid, otherwise known as hypothyroidism. Here we have a diagram showing the different parts of the body that can be affected by the thyroid hormone. As you can see, the thyroid hormone has an impact all the way around the body. Let's have a look at some of this a bit closer. So here we have a number of symptoms that would result from underactive thyroid gland. As you can see, the impact of the thyroid is quite wide, all the way from mental illnesses on the right hand side at the top to your bowels, your hair, your skin, even the way it affects the libido and the period menses in women. Again, it can affect your muscles, your joints. You can feel cold when everybody else is feeling warm in the room, and it does lead to a type of presentation with puffy eyes and mild obesity. A goiter is a general term for a lump of the thyroid gland, and this could also be present depending on the underlying cause of the hypothyroidism or underactive thyroid gland. Here we have a number of signs that would present in a patient with an underactive thyroid. Again, at the top we have mental slowness, thinning of hair, loss of eyebrows. With regard to the heart, it can increase the blood pressure, it can cause heart failure, it can cause something called bradycardia, which is a slowing down of the heartbeat, and it can also cause pericardial effusions, which is fluid around the heart. As mentioned, it can cause mild obesity, the reflexes in the body are slow, it causes weakness of the peripheral muscles, which are the muscles below your elbow, below your knees. It causes edema, which is water retention, and as mentioned, the hands and feet can feel cold all the time, or you could get pains in the palms of your hands, which is carpal tunnel syndrome. So it does have a wide impact on the body, and therefore it's important that we understand how the thyroid gland works, and if you should have a dysfunction of the thyroid gland, how to manage that appropriately and being in control of your own thyroid gland, so that you can ensure that the other functions around the body, from your mental to physical functions, are all working adequately and appropriately. To explore the problems that the thyroid gland can undergo, let's first look at the normal thyroid gland and its function, which will make it easier when looking at dysfunction later on. Here we have a diagram of the top half of the body. You can see here that we have the heart, the two lungs, with the liver and the stomach underneath. Now, from the neck down, here you have your voice box or the larynx, and underneath it is this organ or this tissue, which is the thyroid gland. Now, this is what I would call the battery of the body. That is what generates the hormones, which gives the body the energy or the metabolism it requires. So let's have a closer look at the thyroid gland. Here we have a closer view of the thyroid gland. As you can see, it sits just below the voice box. If you feel down your neck, you should be able to feel the Adam's apple, which is the little bumpy area as you run your finger down the middle of your neck. And just beneath there is where the thyroid gland is, which is shown here in yellow. And behind it is the windpipe. So this is the organ that we're going to have a look at. The main function of this organ is to produce hormones, and as mentioned, the hormone has an effect on the metabolism of the body, which then generates energy, which gives you power. If it's overactive or it's working too hard, the impact is different to if it is working inefficiently, in which case the power of the body goes down. But we'll have a closer look at this once we've explored how the organ functions naturally. Let's have a look at how the thyroid gland is activated and how it functions. Here we have a section of the brain, and if we cut the brain in half, this is what the insides may look like. So we have the main tissue of the brain here on the outsides, and here we have an area called the corpus callosum, which is the area that connects the two halves of the brain together. Now underneath is a small organ, which is only about a pea-sized organ here in red, and that is the pituitary gland. Now for such a small organ, it does have a crucial function in the body, and it's this organ that has the ability to control a number of other organs in the body, one of which is the thyroid gland. Now here we've portrayed the hormone that is released by the pituitary gland as these blue hexagons, otherwise known as the thyroid-stimulating hormone. Now it's this hormone which, when released by the pituitary gland, moves down the bloodstream and heads towards the thyroid gland, and you could think of it as the chemical that activates the thyroid gland to produce the thyroxine that is the hormone that affects the body. So here we have the pituitary gland. Underneath it we have the thyroid stimulating hormone portrayed here in blue, and as we move down you can see how the thyroid stimulating hormone is affecting the thyroid gland. Now underneath we have these red stars and yellow stars. The thyroid gland itself produces two different types of hormones. One is called T3, which is shown here in red, and the other one is T4, which is shown in yellow. Now the actual hormone that has the impact on the body is the red stars, the T3. The yellow stars, the T4, can be broken down by the body into T3, and we'll have a look at that a bit later on. But you can see where the blue hexagons have come down the thyroid stimulating hormone here, activated the thyroid gland. The thyroid gland is producing these red and yellow stars, which are then absorbed into the bloodstream. Now in the bloodstream, 90% plus of thyroid hormones are attached to these proteins. Now it's only the free hormone, which is shown here at the bottom as red stars, which actually has an impact on the body tissues. And therefore this is one way that the body controls how much active or live hormone is present in the bloodstream at any one time. When the body requires more, the proteins can detach the stars, allowing them to then affect the body tissue as well. So this is how the thyroid gland is stimulated. Now the other important thing to note here, which will become relevant later on, is the amount of thyroid hormone, here in red stars, in the bloodstream then regulates the pituitary gland higher up. So when the bloodstream carries the thyroxine back to the pituitary, we have what we call here a negative feedback loop. Now when there is sufficient thyroxine, or T3, in the bloodstream, so let's say we've got enough red stars that are free in the bloodstream, those red stars will go all the way back up to the pituitary and tell the pituitary, we've got enough thyroxine in the bloodstream, you can stop producing your blue hexagons or thyroid stimulating hormones. Once they stop, the impact on the thyroid gland is removed, and therefore the thyroid gland doesn't produce more thyroxine hormone. Once the thyroxine levels in the bloodstream start to drop because the thyroid gland is not producing any more hormone, that reduced blood concentration of the hormone then goes back to the pituitary gland, which is informed that we don't have enough thyroxine in the blood. So the pituitary gland then starts producing more thyroid stimulating hormone, and it works in this quite clever cycle and regulates the amount of thyroxine in the body. So this should provide you some understanding of how the body's thyroid gland functions, with the thyroid stimulating hormone here activating the thyroid gland, which produces T3 and T4 shown with red and yellow stars. The T3 then has the impact on the body, but it also has a negative feedback loop on the pituitary gland so that we don't end up developing or carrying too much active thyroxine in the bloodstream. Let's move on and have a look at how the thyroid gland can be affected in different ways in different illnesses. There are various conditions that can cause an underactive thyroid gland, but the basic principle here is that the thyroid gland isn't producing enough thyroxine. Now, as mentioned earlier with the normal function of a thyroid gland, if there isn't enough thyroxine in the bloodstream, the pituitary gland is not turned off and therefore it carries on producing thyroid-stimulating hormone. So here you can see in a diagrammatic form that we have many more blue hexagons, which are the thyroid-stimulating hormone. And the pituitary is constantly trying to activate this yellow thyroid gland into producing thyroxine, but because of a disease of the thyroid gland, it won't produce enough thyroxine, which means that there is no negative feedback and the pituitary gland carries on producing these blue hexagons. And you can see further down here that there isn't enough yellow or red stars, which is the T3 and T4 from the thyroid gland in the bloodstream. So as mentioned, there isn't enough to get back and turn off the pituitary gland. So what can we do about it? So here's what we can do with an underactive thyroid gland. First, we need to identify what the underlying illness is, but to manage the actual underactive thyroid gland, we can use medication, which is shown here. As you can see, there's many few thyroid-stimulating hormone shown here in blue. And as we move further down, you can now see that although we don't have as many yellow and red stars, we've now added in these turquoise or blue-green stars, which are thyroxine tablets that you've taken orally, prescribed by the GP. So by taking thyroxine tablets, what you're doing is adding to the red stars, and the combination of blue and red stars is now enough for it to have an effect on the pituitary gland, which will then start to turn the production of the hexagons or the thyroid-stimulating hormone off. You may wonder why you need to have such regular blood tests for your thyroid function, and that is because we need to constantly monitor whether you have enough of these turquoise stars within the bloodstream to supplement the red stars to ensure that the cycle of the pituitary gland and the thyroid gland working together is effective. Clearly, not having enough of these turquoise stars in the bloodstream or your thyroxine will have a negative impact on the body. Let's have a look at the thyroid function test. The thyroid function test, otherwise known as TFT, is a straightforward blood test performed by the phlebotomist or the nurse at your local practice, or there may even be community clinics where you can go and have the blood taken. The blood sample taken is sent to the local hospital laboratory where they analyse the sample and send the result back, usually to your GP. Now, the normal reference range for thyroid-stimulating hormone is 0.4 to 5. And we'll explain further down what this means. What we need to be aware of is that a person shouldn't generally be treated on the basis of one abnormal TSH result, because there is what we call a diurnal variation. In other words, through the day, there is fluctuation in the level of thyroid-stimulating hormone in the body, and therefore it's useful to get a second sample to ensure that if there is a dysfunction, then that's confirmed. Also, another thing that's worth considering is that you may have something called antibodies. So just just keep this in mind, antibodies, and we'll discuss that a bit later on. Now, let's move on to the management of abnormal thyroid test. Generally, if we look at a patient who is either symptomatic, they have a thyroid stimulating hormone, which is the level is over 10, and remember we said here above the normal was 0.4 to 5, but here if the level is over 10, or they have reduced thyroxine level in their blood, then it's likely they're going to need thyroxine tablets. Now, when considering treating a patient with thyroxine tablets, ensure that the patient is aware that once they start taking thyroxine tablets, it may take several months before the symptoms resolve. So they shouldn't expect symptoms to disappear within a few days or a few weeks. Also, the other thing is that research shows there is no need, like with many other conditions, to start on a small dose of thyroxine and work our way up. You can start on a full dose, which is, for a female patient who is approximately 60 kilograms, she can be started on a dose of 100 micrograms daily, which is one tablet. And for a male whose weight is about 75 kilograms, they can be started on a dose of 125 micrograms daily. Now, when looking at initiating the thyroxine doses, we need to be aware of patients who are over the age of 60 and also patients who have ischemic heart disease. In both of these conditions, we need to start at a lower dose of around 12.5 micrograms to 25 micrograms and exercise precaution in gradually increasing the dose so there's no adverse effect on the individual. Now, in this situation, they should have their bloods repeated every 3 to 6 weeks until the blood levels come to normal, which is called euthyroid. So hypothyroid, hypo is an underactive thyroid gland. Hyper is an overactive thyroid gland, and euthyroid is a normal thyroid gland or a normal thyroid function. Now, let's move down a bit and look at some other situations. Above, we talked about the normal reference range for TSH, which I'll represent down here as 0.4 to 5. And we said that anybody with a thyroid level above 10 should be treated. But we have this section in between where they may have something called subclinical disease. Now, in effect, what this means is that the full-blown condition hasn't yet developed, but they may suffer with symptoms in this range. And at this level, the thyroxine levels in the blood may also be not normal. So here we're talking about the thyroid-stimulating hormone, which earlier on we described as the blue hexagons. So we've got more blue hexagons than we need, but not too many that the full-blown disease has been developed. Now, at this stage, although we don't necessarily have to treat the condition, we do need to ensure that if a patient is pregnant, which we'll discuss further down, or trying to conceive, then this condition, the subclinical condition, is managed appropriately. The risk of progressing to the full-blown illness when you're in this stage is about 5%. So 5% of patients with subclinical disease will move on to develop the full-blown condition. Now, if at this stage a patient is symptomatic, in other words, they are developing the symptoms that we've mentioned earlier on in this video clip, and their thyroid-stimulating hormone is 5 to 10, then it's worth giving them 6 months of treatment with thyroxine. If it improves, then carry on giving them the tablets. Generally, we'll tend to find that patients who are subclinical and symptomatic, 50% of them will feel better by being given thyroxine. Now, at this stage, if they are subclinical and their thyroid-stimulating hormone is between 5 and 10, it's worth arranging for the thyroid antibodies to be checked. Now, we mentioned the antibodies are higher up here, but check what their thyroid antibody levels are. Now, if they do have thyroid antibodies and they don't warrant treatment because they're not symptomatic, then it is worth doing annual blood tests, annual thyroid function tests, to make sure that their illness doesn't become the full-blown thyroid condition. In terms of monitoring the thyroid condition, the aim of monitoring is to make the patient feel better, but also to try and achieve a TSH level in the lower range, which is between 0.4 to 2.5. It's worth measuring the thyroid levels 8 weeks after you first initiate thyroxine tablets and adjust the dose accordingly depending on what the result of the TSH is. So adjust the dose if TSH is still high. Once it's stable, they only need annual blood test doing. So start the thyroxine tablets, arrange the blood test every 8 to 12 weeks. If the thyroid-stimulating hormone is still high, then adjust the thyroxine dose, increase the dose. And once they're stable or they become euthyroid, then they only need an annual blood test. Now, we should try and avoid patients whose thyroid gland is fully suppressed. Now, what this means is where the thyroid-stimulating hormone is less than 0.1. We mentioned above that the normal range is 0.4 to 5, and ideally we want to try and get the range between 0.4 and 2.5. But a level of 0.1 should be avoided because having a level that low has an impact on the body in causing osteoporosis, which is a thinning of the bones, and can have an adverse effect on the heart by making it go into irregular heart rate and rhythm, which is atrial fibrillation. Now, a partially suppressed thyroid, which is between 0.1 to 0.4, can be acceptable in a younger patient if they remain symptomatic. So if their thyroid stimulating hormone has come down to, let's say, between 0.4 and 2.5, but they're still having symptoms of an underactive thyroid, you can carry on giving them more thyroxine even if their TSH levels drop below 0.4, but do ensure that it doesn't drop below 0.1. Finally, let's have a look at pregnancy and thyroid related problems. An underactive thyroid or hypothyroidism has adverse effects both for the woman in pregnancy and the neonate itself. What we need to ensure is that at the onset of pregnancy, the patient receives treatment even with subclinical hypothyroidism. So the subclinical hypothyroidism is where they have a TSH of between 5 and 10. Treatment needs to be started at a level of 25 to 50 micrograms daily. And we need to regularly check TSH levels. So regularly check. Now, in the pregnancy state, what we want to try and do is aim for a level of 0.4 to 2. Earlier on, we mentioned that a level of 0.1 to 0.4 would be acceptable in a younger patient, but in the pregnant state, we need to ensure that the level remains between 0.4 and 2, so there's no adverse effect on the pregnancy or on the developing neonate. We need to ensure that TFTs are checked every 4 weeks in the first trimester, and then moving on after that, if the patient is stable on the thyroxine dose, then they need another blood test in the second trimester and another test in the third trimester, just to ensure that their thyroxine levels are at the right range between 0.4 and 2. It's always sensible at this stage, unless your GP has a special interest in thyroid problems, to suggest whether you should be referred to a specialist for joint care between your obstetrician and a hormone specialist. And that brings us to the end of an underactive thyroid. I hope you now have a better understanding of the thyroid gland. And for those of you who suffer with an underactive thyroid gland, you can now have an informed discussion with your GP next time you need to discuss your blood results and understand what TSH means and the impact it may have on the dose of your thyroxine tablet.